Hi, good afternoon. My name is William Barnes. This is Larame, Braatz, and MUW Hester. We are here to present you our PowerPoint on hepatitis. We hope this is informative and that you gain knowledge that you can use further in your nursing career. First, we will discuss the learning objectives of this PowerPoint presentation. After completion of this presentation, the learner will be able to apply an understanding of the pathophysiology and risk factors associated with hepatitis with a 90% accuracy. The learner should also be able to differentiate between hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus in regards to signs and symptoms, incubation period, and degree of liver damage with 90% accuracy. The learner should be able to describe how all forms of hepatitis are transmitted with a 95% accuracy. The learner should be able to identify laboratory testing and serologic markers used to diagnose and monitor hepatitis B virus with an 85% accuracy. The learner should also be able to identify factors that contribute to disease progression and factors that may affect treatment responses with 85% accuracy. The learner should be able to describe the effects of impaired liver function on the body with 95% accuracy.
What is viral hepatitis? Hepatitis means inflammation of the liver. Hepatitis is often caused by a virus. The most common types of viral hepatitis are hepatitis A, hepatitis B, and hepatitis C. It is most often caused by a virus, but can also be caused by toxic substances such as alcohol and drugs and autoimmune diseases. Hepatitis can range from self-limiting disease to the progression of cirrhosis or liver cancer.
History of hepatitis. The catastrophic history of jaundice epidemics and pandemics is often associated with major wars. In the American Civil War, 40,000 cases were reported among Union troops. 16 million cases of hepatitis occurred in the Second World War. The breakthrough understanding of hepatitis began in the 1960s when Dr. Bloomberg discovered the antigen that detected hepatitis B virus. Pathophysiology of hepatitis. With an acute hepatitis infection, cytotoxic cytokines and natural killer cells cause destruction of infected liver cells leading to inflammation of the liver. After the infection is resolved, the liver cells are able to regenerate and resume normal appearance and function. This phase typically lasts 1 to 4 months. Chronic hepatitis results in chronic inflammation that can lead to scarring and fibrosis of the liver. Over time, this will progress to cirrhosis, liver failure, or hepatocellular carcinoma.
Hepatitis A virus. This is an infectious type of hepatitis. Its transmission is person to person by fecal-oral route, most often transmitted by consumption of contaminated food or water, and it is highly contagious. Its incubation period is 15 to 50 days on an average of 28 days. Its incidence has declined by 95% in 1995 in the U.S. due to HAV or the hepatitis A virus vaccine. A total of 1,239 cases of hepatitis A virus in 2014 were discovered. The risk factors for hepatitis A virus are persons traveling to countries with high rates of hepatitis A infection, poor sanitation, crowded conditions such as daycare and nursing homes, or contaminated foods. The signs and symptoms are nausea, anorexia, vomiting, low-grade fever, fatigue, abdominal pain, and jaundice, which can lead to dark urine and clay-colored stools. Hepatitis A virus is diagnosed with elevated AST and AL and bilirubin levels. This is confirmed by a positive serologic test for an anti-hepatitis A virus immunoglobulin M. Its prognosis is that most cases are mild and self-limiting. It does not lead to chronic infection and usually lasts less than 2 months with rest and adequate hydration. Part of the prevention of hepatitis A virus is the vaccination with 2-dose series. It has often been found as the best preventative measure. Vaccination is recommended for those at an increased risk for infection that are above 12 months of age. Hand washing after bathroom use and prior to preparing or consuming food is another way to prevent hepatitis A virus. Finally, proper environmental cleaning and sanitation can also help prevent transmission or infection with hepatitis A virus.
Hepatitis B virus or serohepatitis. Transmission is usually sexual contact, blood or bodily fluid contact, contaminated needles, transfusions, or mother to baby at birth. Incubation period is usually 60 to 150 days, with an average of 90 days. Incidents, there has been a total of 2,953 new cases of hepatitis B virus in the U.S. in 2014, an estimated 2.2 million persons in the U.S. and 240 million persons worldwide are infected with chronic hepatitis B virus. Risk factors include infants born to infected mothers, multiple sex partners, homosexual individuals, IV drug users, healthcare and public safety workers, and hemodialysis patients, or travelers to countries with high hepatitis B virus prevalence. Signs and symptoms of hepatitis B include mild abdominal pain, fever, fatigue, anorexia, myopathy, jaundice, or yellowing of skin, dark hearing, playfulness, diagnosis: hepatitis B surface antigen, or HBsAg, IgM anti-HBCs, and anti-HBCs indicate active infection. Hepatitis surface antibodies, or anti-HBCs, indicates recovery and immunity against hepatitis B virus. Prognosis ranges from mild disease to full hepatitis. 15 to 25% of chronically infected result in premature death by cirrhosis or liver cancer. Treatment includes supportive treatment for acute infection, antivirals used for chronic infection. These drugs are Intreva, Larame, Braatz, interferon alpha 2B by injection. Prevention of hepatitis B, the biggest preventative factor is vaccination. All infants beginning at birth should be given 3 IM doses of hepatitis B vaccination. Avoid sharing razors, toothbrushes. Hepatitis B immune globulin should be given for post-exposure prophylaxis in case of
Hepatitis C virus, non-A, non-B hepatitis, transmission, contaminated blood and blood products, sexual transmission possible, renal dialysis patients, and unsterile tattoo equipment. Incubation is 2 to 24 weeks with an average of 4 to 12 weeks. Incidence is estimated total of 30,500 cases of acute HCV in 2014. An estimated 2.7 to 3.9 million people in the U.S. have chronic hepatitis C virus. Risk factors include current or former IV drug users, recipient of blood transfusions prior to 1992, chronic hemodialysis patients, healthcare workers exposed to the hepatitis C virus, HIV-infected persons, and children born to hepatitis C virus infected mothers. This is a picture of what hepatitis C virus will look like. It can cause yellowing of the skin and enlargement of the liver. Signs and symptoms are usually asymptomatic during the initial onset of the HCV. Some symptoms include fever, fatigue, jaundice, nausea, and vomiting. Diagnosis: anti-HCV antibody and HCV RNA indicate infection has occurred. Prognosis: 75 to 85% of persons infected with HCV develop a long-term chronic infection. 15 to 25% of persons clear the virus without treatment. 1 in 5 patients eventually die from chronic HCV. Treatment: antivirals given for acute and chronic forms of HCV. Prevention: there are no vaccines available. The best way to prevent HCV is by avoiding risk behaviors such as sharing needles.
Hepatitis D virus, known as Delta agent. Its transmission is through percutaneous or mucosal contact with infectious blood. It only occurs in those already infected with the hepatitis B virus because the hepatitis D virus is an incomplete virus that requires hepatitis B in order to replicate. Its incubation period is 21 to 140 days, and on average it takes 35 days. Its incidence is uncommon in the United States, as an estimated 15 million are affected worldwide. Its risk factors: current or former IV drug users, persons exposed to unscreened blood or blood products, and homosexual individuals. Signs and symptoms: abdominal pain, nausea, fatigue, jaundice, which is once again yellow in the skin, dark urine, and clay-colored stools. This may worsen the symptoms of the hepatitis B virus. Its diagnosis: a radioimmunoassay indicates anti-hepatitis D virus antibodies. Prognosis: infection with the hepatitis D virus and hepatitis B virus is associated with more severe liver injury than infection with hepatitis B virus alone. 1 in 10 of those infected with the hepatitis D virus will develop chronic liver inflammation. Its treatment: this includes alpha interferon for up to 12 months or a liver transplant. Its prevention: there is no vaccine for hepatitis B virus currently available. Prevention: no vaccine for hepatitis D virus is available. Prevention in persons not already infected with hepatitis B virus will take the hepatitis B virus vaccine.
Hepatitis E virus. Transmission: fecal oral route, undercooked pork or deer meat. The most common source is lethally contaminated drinking water in developing countries. Its incubation period is 15 to 60 days, with an average of 40. Incidence is uncommon in the U.S. due to well-maintained clean water supply and environmental sanitation. Prevalence is highest in East and South Asia. Risk factors include traveling to a developing country with high hepatitis E virus rates, poor sanitation, consumption of undercooked pork or venison. Signs and symptoms are fever, fatigue, anorexia, nausea, vomiting, abdominal pain, jaundice, and joint pain. Diagnosis is confirmed by testing for the presence of antibody against hepatitis E virus or hepatitis E virus RNA. Prognosis usually results in self-limiting acute illness. Chronic forms do not develop. Pregnancy increases severity and mortality. It is usually treated by resolving on its own without treatment. Supportive therapy with rest, adequate nutrition and fluids, and avoiding alcohol and drugs. Prevention: proper sanitation, clean water, and avoiding undercooked pork and venison.
Hepatitis G virus, first discovered in 1995, often found as co-infections with other infections. Clinical significance of this virus remains uncertain. 50% of these patients have received blood transfusions before developing disease. Transmission: contaminated blood and blood products, the mother to newborn during delivery. Incubation is 14 to 145 days. Risk factors are the same for hepatitis B and hepatitis C virus. Prognosis: hepatitis G virus symptoms, if experienced, are typical mild, brief, and self-limiting.
Alcoholic hepatitis, usually caused by inflammation of the liver by drinking too much alcohol. Toxins produced from breaking down alcohol trigger inflammation that destroys liver cells. This results in irreversible scarring or cirrhosis that interferes with normal liver function, final stage of alcoholic liver disease. Signs and symptoms include jaundice, or yellow in the skin and sclera of the eyes, dark urine, clay-colored stools, loss of appetite, nausea, vomiting, and abdominal tenderness, fatigue and weakness, weight loss and malnutrition, ascites, confusion, behavioral changes, liver and kidney failure in late stages. Complications include portal hypertension, varices, ascites, jaundice, hepatic encephalopathy, cirrhosis, kidney failure. The treatment, complete cessation from alcohol is key. Corticosteroids or pentoxiflame for liver inflammation, a liver transplant, and special diet vitamins for acute feeding for malnutrition.
Autoimmune hepatitis. Causes of autoimmune hepatitis are inflammation of the liver caused by the body's immune system attacking the liver cells. The signs and symptoms of autoimmune hepatitis are fatigue, abdominal pain, jaundice, spider angiomas, joint pain, and loss of menstruation in liver. The risk factors for autoimmune hepatitis are being female, are having a history of particular infections such as measles, herpes simplex, Epstein-Barr virus, or the hepatitis A, B, or C viruses. It can also be hereditary, or it can be caused by having an autoimmune disease such as celiac disease, rheumatoid arthritis, or lupus. Prognosis and treatment. If left untreated, autoimmune hepatitis can lead to permanent scarring of the liver and eventual liver failure. Corticosteroids such as prednisone, used initially, and zapioprine may be used and is recommended additionally.
Impact of hepatitis. Most patients with viral hepatitis are cared for at home. The nurse should assess the patient's knowledge related to transmission, nutrition, medication, need for rest, the importance of avoiding alcohol, and what symptoms should be reported to their healthcare provider. Assess all patients for manifestations of complications, such as bleeding tendencies, fluid accumulation, change in level of consciousness, respiratory difficulties, elevated liver function tests, and are strictly to adhere to all follow-up appointments. Support groups are the American Liver Foundation, the Children's Liver Association for Support Service, Hepatitis B Foundation, National Digestive Diseases Information Clearinghouse, U.S. Center for Disease Control and Prevention.
Our problem list for hepatitis includes ineffective breathing pattern related to intra-abdominal fluid collection and decreased lung expansion, imbalance of nutrition, less than body requirements related to nausea, vomiting, and lack of appetite, risk for deficient fluid volume related to third space fluid shifts and excessive loss through vomiting, and risk for bleeding related to altered clotting factors and increased blood pressure in the venous system, and activity intolerance related to fatigue and malaise.
Chronic pain and discomfort related to enlarged tumor liver is another problem that has occurred from the hepatitis virus. Risk for imbalanced body temperature, hypothermia related to inflammatory process of hepatitis. Another is risk for impaired skin integrity related to bile salt accumulation in tissues leading to Braatz. Situational low self-esteem related to debilitating symptoms, medication side effects, and length of illness/recovery. Also, a knowledge deficit related to lack of understanding of disease process, prognosis, and potential complications. Ineffective breathing pattern related to intra-abdominal fluid collection and decreased lung expansion. The nursing medical management would be to monitor the frequency and depth of respirations, noting the respiratory effort. Auscultate the lung sounds, place patient in a semi-phallic position, teach the patient to turn, cough, and deep breathe. Monitor the ABGs, oxygen saturation, and vital capacity while administering oxygen as needed. The physician may perform paracentesis to remove excess fluid. Respiratory therapy should be consulted to assist in the provision of care. Risk for bleeding related to altered clotting factors and increased blood pressure within the venous system. This nursing/medical manager will consider closely assessing for signs and symptoms of GI bleeding, which would be bloody emesis, frank or cold blood in stools. Monitor for changes in blood pressure, pulse, hemoglobin and hematocrit, or level of consciousness. Encourage use of soft toothbrushes and avoid sharp razors, straining for stool, or any aspirin-containing products. The physician may prescribe supplemental vitamins such as vitamin K, D, and C to promote prothrombin synthesis. A direct ligation or banding procedure may be warranted to control active hemorrhage or decrease portal hypertension to prevent rebleeding.
A balanced nutrition lists the body requirements related to nausea, vomiting, and lack of appetite. Nursing medical management. Monitor dietary intake and calorie count. Suggest frequent small feedings. Recommend eating in an upright position. Encourage mouth care before meals and weigh daily. The physician may prescribe an antibiotic, antacids, vitamins, supplements, or supplemental feedings and TPN if necessary. Consultation with a dietitian should be beneficial in formulating an appropriate dietary program to meet individual needs. Risk for deficient fluid volume related to third space fluid shifts and excessive loss through vomiting. Nursing medical management. Assess vital signs, peripheral pulses, capillary refill, skin turgor, and mucus membranes. Monitor IMO and weight daily. Assess for ascites and edema formation. Measure abdominal girth daily. Monitor lab values such as HBG and HCG, electrolytes, clotting times, and albumin daily, and PRN. Physician may prescribe fluids and electrolyte replacements, diuretics, and antiemetics if needed.
Activity and tolerance related to fatigue and weakness. Nursing and medical management would include assessing patients' level of tolerance for activity, providing a quiet environment, encouraging bed rest in your acute states, determine and prioritize interventions that and perform one at a time as tolerated, identify energy-conserving techniques, increase activity as tolerated, monitoring serial liver enzymes for levels of resolution of disease. Physical therapy should be consulted for activity assessment and evaluation. And these are all references.
Thank you for watching our presentation. This will be followed by a 10-question test, which we hope you have success with. You have a great day.